For staying around. We are talking about scar tissue. We are answering a question by one of our subscribers. She asked a question and she said, can you please talk about scar tissue in the fallopian tubes and how you can heal them to avoid ectopic pregnancy? I had one recently at 5 weeks and 6 days of pregnancy. So one of our subscribers asked a question and she was asking about scar tissue. She had one recently at 5 weeks and 6 days, meaning she had an ectopic pregnancy at 5 weeks and 6 days, and this ectopic pregnancy was due to scar tissue. First of all, before we answer this question, we shall say something briefly about scar tissue. When we are talking about the fallopian tubes, these are the two tubes which are in the reproductive system of a woman, and specifically these fallopian tubes are very important because they play a very big role in the transportation of the male sperm, and then also they transport the female egg. They transport a fertilized egg which actually goes up to your womb, and then it attaches onto the uterine wall, bringing about an embryo growing. We call this implantation. There are many times when a couple has had sexual intercourse, there's going to be fertilization taking place in the ampulla. This is a part of the fallopian tube where fertilization takes place. After fertilization has taken place, an egg is supposed to travel through the fallopian tubes up to the womb, whereby when it attaches onto the womb, it grows and then becomes a baby for a period of the next 40 weeks. So one of our subscribers, she asked a question that she actually would like us to talk about scar tissue. And without further ado, we are talking about scar tissue in the fallopian tubes. We've already said that ideally in normal settings, when an egg has been fertilized, it's supposed to travel through the tubes up to the uterine wall where it attaches, up to the womb, the walls of your womb, where it attaches and then it grows. But there are instances when the fallopian tubes are blocked. The blockage of the fallopian tubes is brought about by many things. We shall list these things below. Blockage of the fallopian tubes is normally brought about by infections. These infections are many, but we shall categorize them. There are infections which are known as sexually transmitted infections, for example, chlamydia and gonorrhea. There is also an infection known as a pelvic inflammatory disease, abbreviated as PID. Pelvic inflammatory disease is evidenced by free fluid in the pouch of Douglas. Now, when you are asking about the pouch of Douglas, specifically whenever you do a pelvic ultrasound scan, your doctor will tell you that there's some free fluid in the pouch of Douglas. It is that space which is between your womb and the rectum. That space between your womb and the rectum is what we call the pouch of Douglas. Ideally, it's supposed to be free from any fluid. So when fluid accumulates in that part, then it means there's actually an infection known as a PID. GERALD MASSA, the health educator, is the name of the channel you are on. And I welcome you, my friend, for today's lesson. We are answering a question by one of our subscribers. She asked a question and she said, can you please talk about scar tissue in the tubes? And we have said that scar tissue is normally brought about by infections. It's brought about by previous operations on the fallopian tubes. If you've ever delivered a baby and then you delivered through cesarean section, maybe if at all there's some damage onto your tubes during the procedure in theater, it can later on bring about actually scar tissue to accumulate in your womb. And then also we talked about PID. We said that PID, or pelvic inflammatory disease, when it is poorly treated by drugs, then it actually may develop into a complication. When we talk about poor treatment of a PID, normally it may be that maybe a client or a woman has decided to do self-medication. We discourage self-medication because whenever you go to the pharmacy and then you request for drugs yourself, you request for some few antibiotics, you may actually be getting the treatment, the antibiotics, but you may actually be getting half dosages. You may be getting medication which is not really in the recommended dosages. So the best is always you should see your doctor, who will request for some tests to be done, and these tests include the urine culture and sensitivity. And then this urine and culture sensitivity test can give a complete picture of how your system is and which organisms are present, and then treatment can be given. Next cause of ectopic pregnancies is next cause of blocked fallopian tubes or scar tissue in the fallopian tubes is when you do have a past history of ectopic pregnancies. There are high chances that you can end up with blocked fallopian tubes due to scar tissue. And then we also said that scar tissue can be treated, but in this video today we've been talking about the causes of scar tissue in the fallopian tubes. We say that the first cause of scar tissue in the fallopian tubes is infections, like sexually transmitted infections due to chlamydia, due to other organisms like the trichomonas, and then also if at all you've been having urine tract infections which are poorly treated. Next cause of scar tissue, we said that when fluid accumulates into your tubes, we call this hydrosalpingitis. If at all you are having a history of hydrosalpingitis and you've not had this treated, then there are high chances that it can actually bring about scar tissue. But also blockage in the fallopian tubes can be due to adhesions and then also free fluid and then scar tissue. The goal is to identify which tube has been blocked by scar tissue, and this can be easily identified by doing a pelvic ultrasound scan and then also doing the benefits of eating mangoes during pregnancy. The benefits of eating mangoes during pregnancy. In today's video, we are going to talk about the benefits of eating mangoes during pregnancy. Are you pregnant? Are you searching for the benefits of eating mangoes? Well, this video is for you today. I welcome you, my friend. You are most welcome to our channel, GERALD MASSA, the health educator. And if it's your first time on this channel, remember to subscribe and hit the bell for notifications so that you get to watch new videos we put out every day, new videos we release every day at exactly 17 hours East African time. We are talking about the benefits of eating mangoes during pregnancy with GERALD MASSA, the health educator. After this short message, we are coming back with the benefits of eating mangoes during pregnancy. Thank you, my friend, and we are talking about the benefits of eating mangoes. We shall begin by asking ourselves, is it safe to eat mangoes during pregnancy? The answer is a big yes. You can eat mangoes in pregnancy as they are an excellent source of energy. They also do provide antioxidants, and then also they provide vital nutrients. So mangoes are safe to be eaten during pregnancy because they do provide energy, antioxidants, and also vital nutrients. It's also important to monitor the portions you eat so that you do not overindulge in eating mangoes. So we are moving on to how many mangoes can be consumed. It is best to consume no more than 1 mango a day. Also include mangoes only if your doctor asks you to increase your calorie intake. So if you are a pregnant mother and you are looking at increasing your calorie intake, then at least you can include mangoes in your diet. But you should watch out if you are a pregnant mother and you are already known to be having gestational diabetes, then you should actually stay away from mangoes. But overall, mangoes are very, very important. We are going to talk about the benefits of eating mangoes during pregnancy, and the first benefit is this: mangoes do provide iron, which prevents anemia. Mangoes provide iron, which prevents anemia. Mangoes are rich in vitamin C, and help in the absorption of iron, because basically vitamin C is known to help in the absorption of iron. So mangoes do provide vitamin C, also known as ascorbic acid, which helps in the absorption of iron, which an expectant mother needs to overcome pregnancy-related anemia. So the first function, the first use of eating mangoes, the first benefit of eating mangoes during pregnancy is that mangoes do provide vitamin C, and vitamin C helps in the absorption of iron, which a pregnant mother needs, more specifically beginning from the first trimester. We are moving to the next function of eating mangoes, the next benefit of eating mangoes. The next benefit is that mangoes provide folic acid, which aids in fetal development. Mangoes provide folic acid, which helps in fetal development, or which helps in the development of your baby. Mangoes are a great source of folic acid, which is essential for the development of the baby's brain, or the fetal brain, and the spinal cord. Folic acid do help in the development of the fetal brain and then the spinal cord. So if you are looking at what helps in the development of the baby's brain and the spinal cord, you should eat mangoes. Mango consumption prevents the neural tube defects which occur early in pregnancy. For example, spina bifida is a condition where the neural tube does not close. It remains open, and it is a condition which is really very serious. So consider including mangoes in your diet, basically because they will provide folic acid. Remember, the first point was that mangoes provide iron, and basically the mangoes provide vitamin C, which helps in the absorption of iron. The next point is that mangoes provide folic acid, which helps in the development of the baby's brain and the spinal cord. GERALD MASSA, the health educator, is the name of the channel. I welcome you, my friend, and we are talking about the benefits of eating mangoes during pregnancy. Next benefit, mangoes provide a dietary fiber which manages digestive health. Mangoes provide a dietary fiber which manages digestive health. The fiber content in mangoes helps you feel the fiber content in mangoes helps you to feel full, to feel satisfied for a longer period. Mangoes also do aid in digestion, and they prevent constipation that pregnant women experience in the first trimester. So if you are a pregnant woman and you are having constipation, more specifically in the first trimester, that is from the time of conception up to around 2 to 3 months, then specifically you should consider including mangoes in your diet. They will do help with constipation, and also they will smoothen the whole process of digestion. Next function of eating mangoes, next benefit is that mangoes are a rich oxidant supply. Mangoes provide antioxidants. So mangoes are very, very rich in antioxidants. Specifically, vitamin C in mango acts as a powerful antioxidant that helps develop resistance against free radicals, which can disturb fetal development and even lead to cancers. Vitamin C can also lower the risk of premature birth. So mangoes are very important because they do provide vitamin C, and vitamin C is an antioxidant which helps to absorb the free radicals, which helps in actually prevention of cancer. So consider eating mangoes because they are rich in antioxidants. Vitamin A is also provided by mangoes. We are talking about the next benefit of eating mangoes, and the next benefit is that mangoes do provide vitamin A, which is very important for baby development. The vitamin A abundantly found in mangoes helps in the formation of baby's teeth and bones. It is also essential for eye and immune system development and aids in the development of the heart, the lungs, and the kidneys. So consider eating mangoes because they are rich in vitamin A, which is very essential for eye development of the baby's heart, the baby's lungs, and the baby's kidneys. Next benefit of eating mangoes is that mangoes do provide vitamin B6, which is ideal for fetal development and the nervous system. Mangoes provide vitamin B6, which is ideal for fetal development and the nervous system. Mangoes are a rich source of vitamin B, which plays a role in the nervous system. So consider eating mangoes because they are also rich in vitamin B6. Next benefit of eating mangoes during pregnancy is mangoes do provide magnesium. Magnesium is a mineral element which prevents preeclampsia. Preeclampsia is basically high blood. The signs and symptoms of a twin pregnancy. Twin baby pregnancy symptoms. Conceiving twins is our lesson for today. We are going to look at what are the signs and symptoms that you are pregnant with twins. GERALD MASSA, the health educator, is the name of the channel. We are talking about the signs and symptoms of a twin pregnancy. Are you pregnant? Do you suspect that you could be carrying twins? Then this video is for you. Keep watching. After this short message, I'm coming back and we are going to talk about the signs and symptoms of a twin pregnancy. Thank you. Thanks a lot, my friend, for staying around, for watching our video for today. And by the end of this video, you are going to be knowing all the signs and symptoms of a twin pregnancy. GERALD MASSA, the health educator, is the name of the channel, and I welcome you, my friend. If you are new here, remember to hit the subscribe button, click the subscribe button so that you get new videos we put out every day. On this channel, we talk about women's health, we talk about fertility, ovulation calculator. We do also give pregnancy tips. Subscribe so that you get new videos every day at exactly 17 hours East African time. So without further ado, we should talk about this very important point, that it's only an ultrasound scan that can confirm that you are carrying twins. It is the best way to confirm that you could be carrying twins, but still there are other signs and symptoms which are very important, and they can also help us tell whether you are pregnant with twins or you are carrying a single baby. So what is happening is that some mothers who are pregnant with twins say that they suspect they could be carrying twins, but still they may be having some signs and symptoms. But the truth is that while there are several signs and symptoms of a twin pregnancy, there's also tremendous overlap with the signs and symptoms of a singleton pregnancy. A singleton pregnancy is a type of pregnancy where you are having a single baby or a single fetus. It is impossible to definitely know whether you are carrying twins or multiple babies by simply gauging how you feel or going off of what a home pregnancy test shows. So you cannot do the home pregnancy test with the urine HCG test and then say that you are carrying twins. No, you are going to get results. Still, you will get the positive results, but this is not a conclusive way of telling that you could be carrying a twin pregnancy. So we shall go to the first sign and symptom of a twin pregnancy, and this is more morning sickness. There's a saying about twins that twice is really much. Twice is really much. So what is happening is that if at all you are carrying more than one baby, then if at all at first you are pregnant with one baby, you will get morning sickness. But imagine if you are carrying two babies. If you are carrying two babies or even three babies, then the morning sickness is going to be more. So the first sign that you could be carrying a twin pregnancy is that your morning sickness will be increased. the morning sickness will be a lot. So if you are a woman out there and you are pregnant and your morning sickness, the morning sickness is much as they call it morning sickness, but it is basically that feeling of weakness, that feeling of you're tired, and it can actually come throughout the day. Though they call it morning sickness, but it can actually happen throughout the whole day. But in twin pregnancies, it is going to be much. It is going to be increased. So the first sign that you could be carrying twins is that your morning sickness will be doubled. Next sign of carrying twins, next sign that you could be carrying twins is elevated beta HCG levels. Your beta HCG levels will be elevated, and remember, when we talk about HCG, basically we are talking about the human chorionic gonadotropin hormone. This is the hormone that is released when a woman gets pregnant. It is released by the placenta. It is also released by the corpus luteum, in early pregnancies when fertilization has just taken place. But when the fetus has implanted, or when the baby has implanted onto your womb, then the placenta begins producing the HCG, plus other parts of the body also they could also produce the HCG. So the levels of the HCG are going to be doubled. You cannot conclusively distinguish a single pregnancy from twins on a urine pregnancy test, but still when you do the blood HCG test, the levels are going to be increased. They are going to be doubled. Next pregnancy symptom is that there's going to be severe fatigue. We talked about the morning sickness being doubled. So the next sign that you could be carrying a twin pregnancy is that you are going to be having severe fatigue. Extreme fatigue is the most commonly reported complaint during pregnancy with multiples. So if you are a pregnant mother and you are experiencing extreme fatigue, then there are high chances that you could be actually carrying twins. In some cases, the fatigue can be attributed to other factors, and these include stress, work, and then also poor nutrition, not feeding well, and then having other children you are taking care of. Then still, this means that you could be overworked. But if at all you are pregnant and you are having extreme fatigue, then it is basically very important that you go ahead and talk to your doctor, who will request for some tests to be done, some tests to be performed on you. Another point we need to take is that fatigue is rather a subjective symptom and has many other causes. If at all you are pregnant and you are fatigued, you feel tired a lot, please consider talking to your doctor, who will order some tests. These tests may include a CBC or a complete blood count. Here, a whole check will be done on your blood cells, whereby your doctor will look at your white blood cells, the white blood cell count, the red blood cell count, and then also your platelets. Any abnormalities, any deviations from the normal, then this could actually mean that you could be having another cause or something else causing the fatigue. For example, low hemoglobin levels or having low HB levels. Still, this can be managed if at all it has been identified. If you are pregnant and you are having extreme fatigue, please talk to your doctor so that some tests may be done. If you are in the tropics, like in Africa, this could be, the extreme fatigue could be due to malaria. It could also be due to infection. Next pregnancy symptom to confirm that you could be carrying twins is abnormal AFP test results. Abnormal AFP test results. When we talk about the AFP, we are talking about the alpha fetoprotein. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. Alpha fetoprotein is a blood test performed on pregnant mothers during the second trimester. It's also known as maternal serum screening or multiple marker screening. It is used to identify increased risks of certain birth defects. So if you are pregnant and your levels of the AFP, that is the alpha fetal protein, is really high, then you could be actually carrying twins. But remember, the alpha fetal protein test is used to detect increased chances of getting birth defects. So a twin pregnancy can produce an unusually high or positive result. Still, when you do this alpha fetal protein test, which is used to detect birth defects, but if you do this test in your hospital or in a nearby hospital or health facility and the results turn out to be positive, please consider talking to your doctor. This could be a sign, this could be a symptom of a twin pregnancy. If you do this and then you go ahead and do the obstetric ultrasound scan or the pelvic ultrasound scan, and it turns out and it shows that you are pregnant with one baby, but you have an abnormally high alpha fetal protein test, then please you need to repeat the ultrasound scan, and your sonographer or your doctor doing the scan should really pay more close attention, because the baby could be having some birth defects. For example, birth defects including cardiac issues or defects of the nervous system, like for example the spina bifida. So whenever you are pregnant and you have an abnormally high alpha fetal protein test, then it is very important that you go ahead and talk to your doctor. Next pregnancy symptom to really tell us that you could be pregnant with twins. Next symptom is that you'll be measuring large. Throughout your pregnancy, your doctor or midwife will measure the height of your uterine fundus, measuring from the top of your pubic bone to the top of the uterus. To measure the uterine fundus, measurements are done from the top of your pubic bone. The pubic bone is specifically that bone in your pelvis up to the top of your uterus, that is around your umbilicus or your umbilical cord. This is a method by which estimation of the gestational age is done, but still, if at all the results come out and they are not conclusive, then your doctor or your midwife will request for an ultrasound scan. A twin or multiple pregnancy may cause the mother's uterus to expand beyond the range of a single pregnancy. However, other factors may also increase the measurements. This measurement is more difficult in earlier pregnancies or when the pregnancy is in the early stages, whereby your midwife will basically record that the pregnancy is palatable or it is basically palpable. But later on, as the baby is growing, this measurement is very, very key. It can actually give us a clue, because if at all the measurements for the expected age, if the baby is expected to be 20 weeks, but your measurements are way much more higher, then you could be actually carrying twins. You need to confirm with your doctor you could be carrying twins. Next pregnancy symptom to confirm that you could be carrying twins is fetal movements will be increased. Feeling a baby or babies move inside your womb is one of the most thrilling factors of pregnancy. This is also known as quickening, or the time at which you first feel your baby. This occurs between 18 up to 25 weeks. This is basically in the third and the fourth trimester, but it actually begins in the third and the fourth trimester. This is between 18 to 25 weeks, but is usually detected earlier on in subsequent pregnancies as early as 16 weeks. When women feel movement in early pregnancy, this is normally, it is a sign to show that the baby is well, to show that the baby is okay. But when the movements increase, then it could actually be an indication that you could be pregnant with twins. Next pregnancy symptom to confirm that you could be carrying twins is there's weight gain. While mothers of twins only gain about 10 pounds more than singleton mothers, the amount of weight a woman gains often depends on her height, the body type, and how much she weighed before the pregnancy. So much of the increase in weight gain occurs later on in pregnancy, often after an ultrasound has already confirmed or excluded a diagnosis of twins or multiple babies. So Weight gain is one of the signs and symptoms that you could be carrying a twin pregnancy. In twin pregnancies, your weight will actually double. Gut feelings and hunches is our next pregnancy symptom to really tell us that you could be carrying a twin pregnancy, while the other types in this list refer to some kind of visible evidence. Exaggerated symptoms, abnormal test results, increased morning sickness, and more can also be used to really say that you could be carrying a twin pregnancy. Lastly, the most important point we are taking home from this video is that you should do what we call ultrasound scanning. Seeing is believing. The only way to confirm that you could be or you are carrying twins is by doing an ultrasound scan. Specifically, you do what we call a pelvic or obstetric ultrasound scanning. Though in most cases your doctor will opt for an obstetric ultrasound scanning because it is much more precise, it's much more on point. It is very unlikely that an ultrasound scan would miss an additional baby. At least an ultrasound scan can show that yes, there's a second baby somewhere. However, there have been cases of hidden twins. In particular, a hidden twin is more likely on an early ultrasound scan than when the baby is actually much more grown. Thanks a lot, my friend, for watching today's lesson. By the end of this lesson, I hope you've learned the signs and symptoms that you could be carrying a twin pregnancy. And yes, if you have any questions, ask me all your questions down below in the comments. I will be very happy to answer all your questions. Remember, the signs and symptoms that you could be carrying a twin pregnancy is that there's increased fatigue, there's increased morning sickness, there's elevated beta HCG levels, there's increased alpha fetoprotein levels, there's severe fatigue, and then also the movements will be increased. And then there are also other things which can be detected, but still what you need to do is you should do an ultrasound scan to go ahead and confirm that yes, this is a twin pregnancy. GERALD MASSA, the health educator, is the name of the channel. I thank you, my friend, for watching today's lesson. Remember to subscribe for new videos we release every day. Like, share, and hit the bell for notifications so that YouTube will show you the new videos we put out every day, the new videos we release every day. On this channel, we talk about pregnancy, we talk about the ovulation calendar, we do talk about women's health. Have yourself a fantastic and healthy day. May God bless us all, and see you in my next video tomorrow at exactly 17 hours. Bye bye, take care, God bless, bye. Hello, welcome to our channel. I'm GERALD MASSA, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. high blood pressure in pregnancy. Magnesium present in reasonable amounts in mangoes acts as an excellent natural remedy for pre-eclampsia, while the vitamin E in this fruit helps build fetal muscle and prevents pre-eclampsia. So if you are pregnant and you are at high risk of getting pre-eclampsia, consider eating some mangoes. So the next benefit of eating mangoes is that mangoes beat morning sickness. The fresh taste of mangoes helps prevent morning sickness. Vitamin B6 in this fruit plays a key role in relieving you from nausea and morning sickness. So if you are pregnant and you are suffering from morning sickness, consider eating mangoes because the fresh taste of mangoes helps prevent morning sickness. Vitamin B6 in this fruit also plays a key role in relieving you from nausea and morning sickness. Thank you, my friend, for attending today's lesson. I hope you have learned something, and please, if you have any questions in regards to what we've just discussed, leave your questions in the comments. Ask me your questions. I will answer all your questions. On this channel, Gerald MASSA, the health educator, I talk about women's health. Have yourself a fantastic and healthy day, and may God bless us all. Bye-bye. Another test known as an HSG test, abbreviated, the abbreviation is HSG, but in full we call it a hysterosalpingogram examination or a hysterosalpingogram scan. When you do this, it can show where the blockage is, because some contrast element or some contrast media will be introduced into your fallopian, into your private parts, and then it will travel up to your tubes, whereby whenever it meets a blockage, it will accumulate there, and then your radiologist or your doctor who has done the scan will point out which part is blocked. Remember, you can ask me all your questions in regards to fertility, ovulation, and pregnancy tips. Our goal with this channel, the goal of this channel is to create awareness about fertility. We are to create awareness about reproductive health. Gerald MASSA, the health educator, is the name of the channel. If you are a couple out there and you have tried to get pregnant and things have not really worked out very well, remember, you can schedule a private consultation with me so that I will give you more time, explain to you all the questions you've been having, why you have tried to get pregnant and things have not worked out. You can come to my website, Gerald MASSA, the health educator, and you do your booking. I will talk to you, give you all the time, give you the best advice you can get out there. And one last bit, I did not talk about it, sorry, but remember, if you thank you for attending today's lesson. Remember to subscribe for new videos we release every day, and we release new videos every day at exactly 17 hours. Thank you for attending today's lesson. I hope you've learned something from today's lesson. Let me answer all your questions down below in the comments. Have yourself a fantastic and healthy day. Gerald MASSA, the health educator, wishes you a very fantastic day. Bye-bye.